A bone marrow transplant involves using high doses of chemotherapy to wipe out cancer. The side effect of that chemotherapy, though, can also wipe out a person's bone marrow. Bone marrow stem cells are very rapidly growing cells, very sensitive to chemotherapy. There's really two types of bone marrow transplants we do. The first type, called an autologous bone marrow transplant, is when we get the person's own bone marrow stem cells out of their bloodstream. And we can get more bone marrow stem cells directly out of the bloodstream now than out of the bone marrow itself. These bone marrow stem cells are then frozen and kept safe, and then we can deliver very high doses of chemotherapy to wipe out the cancer. As a side effect, it wipes out the person's bone marrow, but then we can just give them back their bone marrow stem cells like a blood transfusion, and their bone marrow regrows in about 2 weeks. The second type of bone marrow transplant is when we use a normal, healthy donor. To receive a donor bone marrow transplant, that donor needs to be what we call a match. That transplant also involves high doses of chemotherapy to wipe out the cancer, and then the donor's bone marrow is given in the same way, like a blood transfusion, and the bone marrow regrows in about 2 weeks. But this time, it's the donor's bone marrow recovering. And even though that donor is what we call a match, there still are many other minor differences, and that's good and bad. The good part is that those different immune genes can actually fight the cancer and be very powerful in curing patients of very high-risk diseases. The bad part is that new donor immune system can see the patient or the recipient as different and try to get rid of them. And that's what we call graft rejection or graft versus host disease. And that can be a very life-threatening complication. So donor bone marrow transplants are a higher risk type of transplant. We only do when necessary or when the disease warrants doing